Hi, I'm Dr. Mark Hurd, representing the Banff Sport Med Foundation. It's summer, it's beautiful out, you're with your family and you're going crazy because you can't play. You're either pre-surgery for an ACL or a patellar dislocation, or you're 8 to 12 weeks post-op. You've been spinning indoors on the bike, you've been doing your core and following your protocol. Well, today we're going to demonstrate a bunch of activities you can do in this beautiful summer weather and be safe with your knee reconstruction or pre-surgery not to re-injure your knee. The basic principles are still to stay somewhat linear in your activity and to avoid those high-risk twists and turns that can happen in some sports. One of the most fundamental things we use in rehab is cycling. So once you're comfortable on your indoor bike, we're totally happy for you to go outdoors. Start on some easy trails on either a town cruiser or a mountain bike and build up to where you're comfortable on a road bike. Sticking with relatively easy terrain, as well as riding wisely and smartly, not doing crazy downhills, and being aware of stopping and not twisting your knee when you come off your bike. Once you graduate along in the cycling, it's okay to use clip-on pedals, and in fact you cycle more evenly and it's better for your muscle rehab, so we're comfortable with that. The big do's are stay safe, stay linear, be a spinner when you come to a hill, as opposed to standing up and grinding and putting a lot of force through your knee. Spin away. And then when you're cruising on a mountain bike, it's okay to do a blue or a green trail, but we're not happy with you scrambling down a hill or doing some jumps or tabletops. If you're comfortable cycling, one of the other activities that is super common is just to get out there and hike. Good family hike is so rewarding in the summer, and you can participate in that. I recommend at the start using ski poles or hiking poles that are collapsible. In general, being able to control your terrain with your ski poles is super helpful. Once you advance and start feeling more comfortable, you'll use your ski poles mostly for the downhills, and you can pack them up and put them in your day pack for going uphills. We wouldn't want you to do some free scrambling on scree or scrambling up mountains, but I think any good marked trail is totally acceptable at this point, either preoperatively or postoperatively. Lastly, everyone wants to be in the water, and there's definitely activities you can do in the water that are safe. We usually introduce some swimming at 3 months, as well as you could get in a kayak, but a really good exercise is stand-up paddleboarding or supping. It works your core, it works your balance, and it is really good for just getting all your muscles firing, and it's safe to do. The worst scenario is falling off your sup into the water, and at 3 months post-op, that likely isn't going to injure your knee. So now that we've given you a few examples, I hope you can get out there and really enjoy your summer and not feel so isolated and alone.